everybody. Welcome to Digital Health Talks. This is Megan Antonelli, and I am so excited to be here with Lisa Suennen. I've known Lisa for many years, and she is now the managing partner at American Heart Association Ventures. And we're so excited to have her here today. She was just featured as a Forbes over 50 person, and that is an amazing honor. And I am excited to have her on the show and hear about all of the incredible work that she's been doing at AHA Ventures and how that ties up to healthcare innovation. Hi, Lisa. How are you?
I'm great. It's so nice to see you and sort of see you anyway. See you on the screen.
You're right. You're right. The way it is now, right? Although we have seen each other at many a conference, right?
We have indeed. We have indeed.
Yeah. So, but it is, it's such an interesting time as we have kind of, I think and I always go back to it, but since the pandemic where we've had this kind of digital explosion, if you will, within healthcare, where I feel like we're no longer saying, oh, we're so risk adverse or we're not implementing tech in the same, as fast as everybody else, that there's been an adoption sprint. And now we're here and it's a question of what's working and what's not, and who needs more help and where the help needs to be, right? And you've always had your finger on the pulse of all of that. So tell us a little bit about what you've been doing at AHA Ventures and, where you see all this is going.
Yeah. So I've been at AHA Ventures full-time now for, since January of 2024. So, going on a year and 3 quarters. Of course, I've been affiliated here for a long, long time, helped start their very first fund back almost 10 years ago, Cardiation. And, we've had a couple of years of significant expansion. We had Cardiation running. It's in its second fund, and it focuses mostly on medical devices and the traditional sectors of medical devices. All of our work and all of our funds and activities circles around heart and brain health. So that's their focus. We had also started about 6 years ago a social impact fund that invests in things around the social determinants of health. That is now raised. It continuously raises and invests and supports companies, both for-profit and not-for-profit. So that's invested now probably about $35 million against, maybe 50-something million raised. And we are continuously expanding that. We have started in the last year Go Red for Women venture fund focused on women's health. By which I mean heart and brain health for women and all of the associated conditions that contribute to heart and brain health. So that can be autoimmune disorders, it could be certain gynecological disorders, it could be things like gastrointestinal disorders, things that contribute to heart and brain health or the lack thereof. And then we've also started a venture studio to co-create or create new organizations, new companies, for-profit organizations that can solve problems that have not been fully addressed out in the field. So we're excited. We are still involved with MedTech Innovator. We're still involved with a lot of organizations really trying to engage at the front of the field across all the sectors, although biotech is not one we're focusing on yet here at AHA Ventures.
Yeah. Yeah, well, the med device and the MedTech Innovator Group is great, and the work that they're doing there and what's coming out of it.
Yeah.
But to go back to with Cardiation, what are some of the companies or success stories that have come out of there?
Well, one success story is Barty that was exited. I mean, the fund has not had a lot of exits, like in keeping with most of healthcare. The exit timeline is quite long, but we've invested in companies around sleep. So like Wesper, which is a home apnea monitoring company, and then Restera, which is treatment for sleep apnea. We've invested in a whole bunch of, different organizations that address everything from congestive heart failure and valve disease and neurological conditions. So really pretty broad based and willing to support both PMA and 510K type devices. Really strong fund, great team.
Yeah. Yeah, no, it is. It's amazing. I mean, having been, I think, to my first scientific sessions, maybe now I guess it was maybe 4 or 5 years ago. I guess four in terms of just the expanse of
Mhm.
what it covers, and
Yeah.
and certainly the traditional, pharmaceutical players and biotech players are there. But even watching the change over
Yeah.
those last 4 years, right, where it was very much, pharma dominated to now, being, much more of the technology, the digital health
Mhm.
players, med device, lots
It's
of.
interesting. I mean, I think that intersection of device and digital is now becoming very real. We talked about it forever and ever, and it really wasn't a thing. And
Right.
it's starting to be a thing, right? And, so one of the companies in cardiation, for instance, is BioLink. It's got a biosensor, wearable sensor for glucose monitoring, not unlike some of the others that are out there, except that it's incredibly sensitive and specific. And it also has some interesting ability to measure things other than glucose. So, we're doing partnering through that company with other analyte type organizations. And it also has a kind of cool feature that it lights up in different colors based on, whether you're in the range or not in the range. So it's
Mm.
really easy for people to follow. Yeah, there's some really great stuff in that intersection.
Yeah, yeah, no, it's amazing. And then on the social determinants of health side with the social impact fund, I mean, and I think it's such a, important sort of, sort of public health concern, and the, sort of
Oh,
whether the diversity and the equity around heart health that, there's a lot of potential there. Are there, what are the companies like there? Are there some stars in that portfolio? Or, also I just think that there's interesting movement that's happening, like social determinants of health, SDOH kind of became this like
mhm.
thing that everybody was talking about for a while. And then there was this little bit of pushback of like, how is it going to impact the providers? How can they collect more data? They already do so much. And now, as we have these new AI ambient tools that are able to collect some of this data and maybe process what we can do with it, there's a whole, I think there's a new potential. Are you seeing that in any of the companies, or even just crossing?
Yeah, I mean, we're seeing some of it on the social determinant side. I think there's a lot of reticence to adopt AI in the clinical realms yet. I mean, it's very much powering through the administrative side of things, but when it comes to real patient data, real patient information, real patient care, it's going a lot more slowly, and that might be a good thing,
Right.
considering it's not, fully perfect. Not that anything's perfect, and everybody always says, "Yeah, well, doctors make mistakes too." That's true, but I think having eyes on patients generally tends to improve the use of the data. But we've made investments in lots of interesting tech platforms in the social impact fund, like Pear Suite is a really good example. It's a tech-enabled service, so it helps people become and get trained and certified as community health workers, and then is a network that payers and providers can use to equip community health workers to serve their patients well and effectively. It's really grown quite a lot, mostly on the West Coast at this point, but really both serves we have three focus areas in the social impact fund. One is healthcare quality and access, improving that. One is economic empowerment, which is things like workforce creation, job upskilling, and variety of things that are more around financial supports to help people be able to afford healthcare or afford, to live in a world where they can be healthier. And then the third area is food security and nutrition security. So Pear Suite actually touches the quality and access side of things and improves access to community health workers, which help in underserved communities. But it also improves economic empowerment because creates jobs for people, getting them, trained up as community health workers. So it's a really
Right.
nice example for us. We've also had a similar investment in a similar kind of idea called a company called Oben Health that trains barber shops and manicurists, barbershop workers, manicurists, et cetera, to be community health workers similarly and do hypertension testing for people who are coming in. So people get access to trusted health advisors effectively, the community health workers that are the people they would otherwise be coming to get their hair done or their nails done. But
Right.
also those people, the barbers and others, get another source of income.
Hmm. Hmm.
So it's a
That's
really
yeah, that's
cool
so
kind of
interesting.
thing.
I a friend of mine who also works in healthcare, we're always talking about how when you go to the hospital or you go to the doctor's office, you're not getting the services that you actually want to get at them, right? You're getting things
Not
that you
always.
typically, right? Typically, it's, I have to get my shots, I have to get my vaccines, I have to get my
Mhm.
various tests. It's not, and then you go to the spa or the wellness center or wherever where you get your massage and, maybe various other injections, but they're different, different and very much, sort of what you want. And if there were those, sort of models where they're coming together, and I think we're seeing that here, at least in California, we've got a
Yeah.
few sort of primary care that are really leaning in that wellness vein, where they also have, pickleball courts
Yeah.
and,
Yeah.
and physicians. But so the,
Exactly.
but that's such a great, give people healthcare where they are, which is,
Exactly. Exactly.
and it's also, I mean, we've watched a lot happen with the retail pharmacies and kind of their efforts in that area that have been less, some more successful than others, I guess.
Yeah. Well, it's really an interesting problem to get. I mean, trust is so important in healthcare. It's why I think the clinical side of AI is slow to happen because
Mhm.
people don't fully trust that.
Right.
And both trust and dignity and treating people with real sensitivity and personal respect is so critical.
Hmm.
And I think
Yeah,
that's particularly so so with all people truly, but with populations that are not accustomed to it, it's particularly so, right?
for sure. Yeah, no, and I think that intersection of kind of the trust and the risk and what's involved makes everyone quite cautious when it comes to health.
Exactly.
Understandably so, for sure.
Yep. Yep. Yep.
But it's, I think, that you trust your hairdresser.
You see them a lot more frequently, that is for
All right.
sure.
And have certainly lot more in-depth conversations for better or for worse, right?
Yeah,
So,
right.
but then of course the third piece of this, which is the women's
Go red for women, yeah.
go red for women, which is my favorite. And and I think ties to your leadership in healthcare, which you've been known for with C Sweetener and everything you've done to kind of build the mentor community among women in digital health and sort of the investment community certainly. How tell me about sort of how that's gone and how that's been.
Yeah.
Nancy Brown and the organization at the American Heart Association is amazing. And the group of sort of advocacy and women groups involved are incredible. And yet it is also an organization that's very based in Texas. That is, there's,
Well, I mean, we're certainly headquartered in Texas, but we
right,
are national and international. We're in, I
for
think,
sure.
90 countries or something like that, and we have staff in every single state. And I think, we're not a political organization. We're extremely bipartisan and really focused on only one thing, which is improving, health and hope for everybody, and particularly focused around heart and brain health. And so for us, caring about women, 51% of the population is, not something to avoid. It's something to really lean into. And we have long had a Go Red for Women initiative at AHA to educate women about heart health, about brain health, about taking better care of themselves, what to worry about when you go to the doctor, what to ask about, what to think about. And so it became very natural for us to start a fund focused on that same idea, but thinking about funding the companies that will serve the women who are asking these questions, right?
Mm-hmm.
And so we're still raising it, but we've already started investing. We've actually made our first investment, but we haven't announced it yet. We will in a couple of weeks. And it's very much in line, again, with our mission to improve access and quality and care and services for women in categories that are often overlooked, or underserved or misdiagnosed, or whatever they may be. So I think you'll see probably this year, you'll see at least 2 or 3 investments from us that are spanning device, diagnostics, services, tech, the whole range of things, really thinking broadly about how you not just serve women, but serve healthcare through the women's lens. So you're better taking care of people. And if those, companies, the advances they make and the research they, build off of and all the things and help everybody, men and women, that's great, but we want to make sure that the things that are differentiated in women, the things that are disproportionately experienced by women um, are attended to,
Yeah.
particularly.
Well, and it is, I mean, I think that it's been, we're seeing so much obviously with the sort of focus on menopause and the focus on women's health
Mm-hmm.
in general, that there's this kind of media buzz around it, as well
Yeah.
as lots of different various types of companies where you can get that that specialized health, right, from whether
Yes.
it's Winona or MIDI or Maven Clinic, and that there's been a number of different models coming into play that sort of serve that audience better or serve that demographic better, but yet still struggling a bit. What is your sort of thoughts on that kind of market and where,
Yeah, I mean, if you're asking me specifically about menopause, I mean, I think it's been interesting. I mean, the great news is that we're openly talking about it as a thing. It's not behind the curtain anymore, right?
Mhm.
And since every single woman alive who reaches, middle age will experience it, it shouldn't be some big secret. Um, I am really grateful for that, and I think the companies that are standing out in front in that field there's a lot to thank them for.
Mhm.
I think the business models have been really hard to find, and we haven't yet backed a company in this space. We'd love to find one that we feel is got a long-term sustainable business that can be very profitable and can be, really effective in serving the population. And while there are some that are making great strides, we just haven't, found
Mhm.
the right,
Yeah.
square peg for ourselves quite
Yeah,
yet.
I mean, I think, I don't know. I feel like it's Matthew Holt talks about it a lot on the LinkedIn's, right? On the socials. But, that the primary care model is hard for both, if you're addressing the whole population, it's hard. So if you take 51% and you're
Mhm.
helping them, the figuring out how to monetize that is and make it sustainable is tough. But
Well,
there's
it's
been
interesting because
strides.
it's a field where it's very much about services right now. The drugs you use to treat people are mostly generic. There are no devices. The diagnostics are, so that's a place where there's a lot of advantage, or a lot of innovation coming forward, I think, for like home diagnostics and the like right now. Um, but until there's a really good payment structure for all this stuff and a really good construct to make a difference in treatment. I mean, diagnostics are only as good as the treatment changes, right? The treatment's only as good as it works and, gets to the right people. So you really have to think about how you leverage technology and services to achieve those objectives in a way that can be profitable. It's very tough.
Right. Absolutely. Yeah, no, and I mean, one of the great things that I've seen about the tech and the sort of developments actually doing the competition with the American Heart Association is around the kind of devices designed for women. So kind of
Mm-hmm.
the cardiology, the meters and the things that are the
Mm-hmm.
bras. I think it was Blooming Health one year that participated.
Yeah.
Um, where you really realize that these technologies and devices were designed for men, and there are ways to
Yeah.
improve them that make them much more accessible for others.
Yeah, I mean, we're really interested in the whole field of inoka, which, is basically a form of heart disease that is microvascular disease in women that causes, myocardial infarction and, and things of that nature,
Mm-hmm.
which is very much not detectable on the normal means of looking for heart disease that when you go to a cardiologist. So, we're thinking about how do you look for new diagnostics, look for new interventions that can make a difference for people. I had a friend who had his experience very recently, had an MI that was based, from that microvascular disease. Nobody saw it coming. She was very young. And, getting somebody to pay attention to her that way has been really challenging.
Mm-hmm. Yeah, no, it is. And I think that, I mean, that goes back to the sort of trust and the trust that isn't there. And that part of it is that because certain populations and certain conditions have been overlooked for various reasons, so it's a bigger piece than just technology. And
It's education of the physicians as well. It's a
right.
pretty broad, cultural problem. So
Yeah,
we're getting
exactly.
there. We're getting there slowly
Yeah,
but surely.
step by step, right? Sometimes two steps forward, one step back, but hopefully we get there. So we always talk about, we have a female founder series. We talk to a lot of female innovators and founders, and try to provide some foundation for advice. But as you're having worked with many of them through for your various career stages, what are your thoughts, particularly now as the landscape has changed maybe a bit, and there's sort of more attention being focused on women's health, but also just opportunities for funding and the challenges that might be there?
I think, well, women's health, by the way, if you look at the companies, the vast majority of them are founded and run by men. So it's not a women's health equals women's founders thing. I mean, women founders come in every part of healthcare. And so I think I encourage women to do what they're passionate about, whether it has to do with women or not. We don't make men sit in a box looking at only their own types. Um, Look, I mean, you'd be lying to people if you said it isn't harder. It's harder to raise the money. It's harder to get the respect among the funding community. I think that you have to be incredibly resilient, incredibly confident without being arrogant that you're doing the right thing, and just go straight at it. There's all you can do. And um, find your people, the people who believe in you, who are willing to give you that first dollar, to support what your needs, willing to support you in your efforts. Find your mentors, find your coaches, and really commit, because it's a long haul no matter what kind of entrepreneur you are. But for women, it sometimes takes more. But we're used to that. We're used to doing more than others. And this is no different. You don't get any special credit for being of any particular group. I think in healthcare, you got to really try hard. It's a lot of work.
Yeah, no joke. And healthcare is one of the harder ones. So thinking more broadly beyond just women innovators and founders, what are some of the key elements that as we kind of walk into this AI transformed healthcare world that you're looking at in terms of whether it's the tech or the business model? What's important? What's important? What's important now?
I think what's important is why. What is the thing you're doing? AI for the sake of AI is not interesting at all to me. There's a lot of companies out that are doing, AI for very, very niche things. Also not interesting to me. Niche things you can't spend a lot of money on them because they're going to get rolled up into something else, and the high valuations associated with them right now because it says AI are, absurd. So real differentiation in the outcome of the technology. The technology, I kind of like think about it like the internet. When the internet came out, for those who are old enough to remember, it was the only thing people talked about. The internet, the internet, the internet, the internet. These were companies that were about the internet, and nobody ever talks about that anymore. But it's ubiquitous. The internet is ubiquitous. We would not be talking today were it not for the internet, right? And were it not for the investment made around the development. But it became more or less a tool that isn't differentiated anymore, a utility in effect. And I do think there's something to be said for how we're going to be experiencing AI. It'll be everywhere, it'll be ubiquitous, and it will be a few players, that are constantly improving the utility. The application of that utility to good outcome is essential. Now, we've done okay on the administrative side, making a difference, getting, stupid work out and things like that. But on the clinical side, we still have a lot of work to do to get the data that goes into the internet, or AI in this case, to be good. And so the output of it is good. I mean, I keep seeing articles about how, AI performs well on medical tests, like doctors do. Good, that's good. But does it perform well on patient, intervention, not great yet. It's pretty weak. And until it's more reliably capable of doing that, we need to have people in the loop. So I think any AI that improves the work of people to do more and better for patients is great, potentially. I think we need to prove it and validate these algorithms. One of the things HA is doing is developing a validation suite for cardiovascular and brain health algorithms for companies to go in and check them against more objective data. And I think, the business model needs to be about the service that comes out the other end, not the technology itself.
Right. Yeah. I mean, I think that's such an important point in that right now, it's almost like the AI is there and it has this promise, but it actually is creating more work in some cases than less, because you have to check it. And the requirements to check it, certainly within healthcare, maybe it's not as important on my blog post, but ultimately in healthcare it is, and so
there's no doubt it'll help people find rare disease in a way that we couldn't before, and think there's definite positive applications.
Right. Absolutely. And the promise is there. We're just not quite there yet. So on that, we also do a segment called 5 Good Things. So we always like to end on the, what are you most excited about? What is the thing when you look at healthcare and you say, this is why I'm still in it. This is the good thing that's coming or that's happening now.
Okay. 5, huh? Okay.
You don't have to give me 5. You only have to give me 1.
Oh, 1? Actually, despite the fact that I really like ice cream and pizza, I'm pretty excited about the focus on good nutrition that's happening right now. I mean, I don't care where you sit in the political spectrum, better eating equals better health. And I think that's a positive. I'm also excited about the efforts to advance the field around dementia and Alzheimer's and brain health generally. That is going to be the crisis of the next 25 years as people age. And we have to do better on the caregiving front. We have to do better on the diagnostic and treatment front. And so I'm glad there's a lot of people digging into neuro and really trying to crack the code there.
Yeah.
And the other thing I'd say, I'll give you one more. I'm seeing some really cool stuff in rehabilitation from stroke. So people who've had strokes, but it's been a long time, more than 6 months, when they used to think that you were done getting better. We're seeing a lot of interesting products to demonstrate that you can get better later and recover function. And I think that is all about the intersection of technology and devices and nerves and, brain stimulation. Things are really cool. Bioelectric medicine opportunity there. Very, very powerful.
Yeah. That actually sums up what I love about the American Heart Association and the Scientific Sessions Conference, having been, a HIMSS, devotee and health and vibe, where we talk a lot about the systems that support healthcare and the infrastructure that makes healthcare, money pass and your, appointments get made. When you go to the American Heart Association meetings, it's really about the medicine, the intersection of what is helping patients and helping physicians and clinicians diagnose and treat patients in such a way that is very exciting. And the broad base of it in that, basically cardiology and stroke covers basically everything.
Yeah. Yeah. No, it's exciting to watch. Science marches forward, and hopefully we will continue to reap the benefits of it on the entrepreneurial side of things.
Yeah. Well, it's very exciting to have you in that role and to get a chance to speak to you, almost 2 years in. And I hope I'll see you both at Health and at AHA.
You will. I'm unavoidable. But I do appreciate the opportunity to be on your show, Megan. And I, look forward to the next opportunity to speak.
Absolutely. Me too, Lisa. Take care. And thank you, everyone, for listening. This is Megan Antonelli signing off of Digital Health Talks by Health Impact Live.